Recording? Okay, great. We are recording now. Good afternoon, good morning, everybody. My name is Tinka Duran. I'm the program manager for our colorectal cancer screening initiative. Thank you all for joining. We truly appreciate it. We have quite a bit of information to go over, and we have multiple speakers. So with that, I'm going to go ahead and get started. If we get background noise, right now everybody is unmuted, but if we get some background noise, I'm able to mute everybody. So if you have any questions, I don't know if you can raise your hand, but there is a chat box and you can type in the chat box if you are on the webinar and can visually see it on your computer. If you are only in listening mode and don't have access to your computer, at the end of our presentation, there will also be time for questions. Right now, we don't seem to have any background noise, so I'm just going to keep moving through and leave everybody unmuted. So if you have a question at this time, as we go along, you are able to answer or ask questions. If we start having interruptions, then I'll let you know and we'll have to mute. All right, so welcome. Thank you, everybody, for joining. We're excited to have you. We've been very busy. I have just a short little bit of couple slides, just introductory slides, and then I'm going to let my staff take over. And they'll do a great job, and they've got a lot of information to share with you. Next slide. Come on. All right, so this is our agenda for today. We're going to do some introductions, and then we also are going to have the Great Plains BCCTF, Breast and Cervical Cancer Early Detection Program, give us an update. We want to show you some cancer survivor stories that we have created. We also want to talk about upcoming March is Colorectal Cancer Awareness Month. So we're excited to tell you what we have to offer for you guys and what we'll be doing. We want to talk to you about tribal proclamations for the month of March. We are moving. We have some new information on our new address. And then we have some updates, questions, open discussions. If we have time, we'll show a video or two that we have. If not, then we'll just move on from there. So with that, we will start. And I think, Kendra Rowland, are you on and can you hear me?
Hi, Tinka.
Hi.
I am on.
Okay, so I'll go ahead and advance the slide. And Kendra is a program manager. I'll just give you a quick intro of our Breast and Cervical Cancer Early Detection Program. In short, we call it BCCTF, and she can give you some updates about that. Thanks, Kendra.
Thank you. All right, so I just want to, like Tinka said, my name is Kendra Rowland, and I'm the program manager for the Great Plains Breast and Cervical Cancer Early Detection Program, or BCCTF. I also have two of our other staff members who are part of this program on the line as well. I have Terry Rattler, who is our program coordinator, and then I also have Brenna Lanu, who is our patient navigator. So I'm just going to give you guys kind of a very brief update. As many of you probably already are aware, we received a 5-year cooperative funding agreement for Centers for Disease Control to implement the Breast and Cervical Cancer Early Detection Program. And really the overall goal that our program is to provide breast and cervical cancer screenings, diagnostic services, and treatment referral services to low-income American Indian, Alaska Native women. And currently we are about 7 months into our program, and we are still working very closely with our funders to lay the framework and the groundwork to get our program up and running. So at the moment, we are going to be, if you want to move the slide forward, please. We are going to be working on implementing evidence-based interventions with, it could be an IHS clinic, it could be a tribal health program. That's currently what we're going to be focusing on. And these EBIs that we are focusing on are very similar to what the CRC program has done in the past with their sub-awards as well. So these would be potential EBIs could include provider reminders, client reminders. We can do provider assessments and feedback, or reducing structural barriers, excuse me. And at the moment, we do not have any identified clinics that we are going to be implementing this in. We are working on that process. So if there is anyone who has any interest in doing this type of work in regards to breast and cervical cancer screening, please feel free to reach out to me, and we can work and discuss what a potential project or collaboration could look like. Currently, we've also, our patient navigator.
All right, well, I'm gonna go ahead and mute everybody except for Kendra. So Kendra, I'm sorry, hold on just a moment, please. Let me find Kendra. All right, Kendra, I've unmuted you, so please continue. Sorry about that.
Okay, no, that's okay. So, and then besides working on implementing our evidence-based interventions, we've also had our patient navigator, Brenna, has been working very hard on developing culturally appropriate educational materials. So currently we have a HPV vaccination mythbuster fact sheet, and we have a cervical cancer fact sheet, and we also have an HPV fact sheet that are available. If you go to our website or get in touch with us, you would be able to request these materials if you're interested in handing them out. And we also, in collaboration with the Colorectal program, we will be sending monthly newsletters out, and that monthly newsletter should be going out within the next day or so. There's a cervical cancer and HPV focus for this month, just because January is Cervical Cancer Awareness Month. Additionally, the other thing, you can progress the slide forward, please. The other work that we've been doing, because it was January, is that we really wanted to increase awareness of HPV and cervical cancer. And so we were working with a few tribal community colleges to show this documentary. It's called Someone You Love, the HP Epidemic. And it follows 5 young women who have contracted HPV, and then it talks about their story of living with HPV, cancer, and recovery. It's a really powerful documentary. We've received a lot of positive feedback about showing this in these different settings. So if you work in this in a community college, or are interested in having this implemented within your community, please get in touch with me, and we can work on setting up a viewing and provide you with the corresponding documentation for giving out educational materials. Other than that, that's really all I have for updates. Sorry, that was really quick. We've just been trying to really do a lot of programmatic activities and work internally, but we are, again, if anyone is interested in doing the HPV, the documentary, or interested in doing health systems changes with our EBIs, please reach out to me. And I believe Tinka has my contact info as well. So if you reach out to her, she will be sure to forward that to me, and we can get in touch.
Sure, most definitely. Yep, thank you, Kendra. I will unmute everybody real quick. Is there any questions? You should be able to ask them now. All right. Well, we're going to go ahead and continue. I'm going to mute everybody again. And I think, Gina, you're up next, correct? So I will mute everybody but you. Hold on. Just a moment. Let me find you. Oh, yeah. You're one of the Lindsay Huffmans. For some reason, I'm not quite sure why that happens. But we will unmute both Lindsay Huffmans. All right, Lena, I'm trying to say Gina and Lindsay at the same time. Gina, you are up next. I can't hear you. Lindsay or Gina? Hello, Gina. Well, Gina, maybe you might want to bop in here, but I can go ahead and pick this up for time's sake. And when you get a second, why don't you just come on into my office, because I'm not sure what's going on with your stuff. You are unmuted, but you are not getting any information. Oh, here she comes. Yay. All right. So go ahead and introduce. I'll let you go ahead.
Okay. Thank you, Tinka. Good morning, everybody. I'm Gina Johnson. I'm a patient navigator with the Great Plains Colorectal Cancer Screening Initiative. And we have a new member to our team, Lindsay Huffman. She is our newest patient navigator. She's an enrolled member of the Rosebud Sioux tribe. She is married with 2 beautiful daughters. And aside from working with us, Lindsay also owns her own business where she applies permanent makeup. So we're really happy to have her on board. And she's going to focus on our tribal communities within Nebraska and Iowa, and also Rosebud Sioux tribe.
Wave, Lindsay. Oh. All right. You can just go ahead and just push that. Okay. Yeah. You have to push them twice.
Okay. So we wanted to highlight our website. We have a survivor stories portion to it. We've been working on this for the past 6 months. Our goal of this new website is to provide visitors an easy and informational way to understand the importance of colorectal cancer screening, and that it is preventable, treatable, and beatable. So if you go to our website, you'll see the option there to click on cancer survivor stories.
So real quick, I just want to add something. So if you know people, we currently have, I think, 3 or 4 of them up now. This is a little older picture, but if you know people that would like to share their colorectal cancer survivor stories, we are looking at opening it up to any cancer survivor stories, because survivorship is a hard thing, and we really want to showcase those survivors. So they can fill out the questionnaire themselves, or if you want to help them, or if they need help from us, we'll contact them and help them as well with the app and help them filling out the questions. We'd love to get as many survivor stories on there as we can, so spread the word.
Yes. Okay, so the cancer survivor stories also include an option to share your story. Some of the questions ask for your tribal affiliation, your background, your history of colorectal cancer, and what effects it's had on you and your family. The goal of this feature is to encourage adults to share their cancer experiences with others in an effort to encourage the importance of completing your colorectal cancer screening. Also included on this website is an option to join our listserv and access the community healthcare health webinars. The community health webinars series will link you to YouTube videos that are recorded from our past webinars. Okay, so advancing the slides. So March is Colorectal Cancer Awareness Month. So we're going to be participating in a Dress in Blue Day, our staff here at the Tribal Chairman's Health Board, and that's going to be the first Friday of March, the 2nd of March. The idea for the Dress in Blue Day was originally from Anita Mitchell, and she is a stage 4 colorectal cancer survivor. With that being said, we'll also be gifting our tribal clinics throughout the Great Plains area with posters, fact sheets, and brochures to promote colorectal cancer awareness. We'll be promoting the Show Your Blue campaign again. We'll also be doing the hashtag ShowYourBlueGP. So we encourage you to add that to your social media, your Facebook, Instagram. And if your organization is interested in participating in the Show Your Blue campaign, we'll be sending out registration forms, and those will also be available on our website. And we'll be gifting first, second, and third place winners with a canvas print of your group photo. We've had some really creative photos last year. We had a team who all dressed as blue Smurfs. It's just a lot of fun and a way to bring your team together and highlight the importance of getting screened. We'll also be doing ads throughout tribal radio stations and newspapers. Many of our communities will also be hosting screening events throughout the month of March. If your clinic is interested in hosting a screening event, we are happy to attend. We can bring our inflatable colon. To book your colon, you'll need to contact one of us, and we can send you the registration form for that. I'm not quite sure if we have that request form on our website or not. If not, maybe we should add it. Our team looks forward to collaborating with our tribal communities for the month of March. We're really excited. It's fast approaching, and you know, we encourage you to get your team together and dress in blue. Okay, so we're going to go on and talk about tribal proclamations. A proclamation is a public or official announcement, especially one dealing with a matter of great importance. Because colorectal cancer is the second leading cause of death in the United States among both men and women combined, the Great Plains Colorectal Cancer Screening Initiative sent letters to each tribe throughout the Great Plains area asking for their support in proclaiming March as Colorectal Cancer Awareness Month. By doing so, this can help raise public awareness about the risks, methods, and of prevention for colorectal cancer. We are pleased to announce that one of our tribal communities in the Great Plains area has proclaimed March as Colorectal Cancer Awareness Month. And we are going to highlight that within the local tribal paper and also on the radio there and in their newsletter. And if you receive this letter, we encourage you to encourage your tribal council and chairman to proclaim March as Colorectal Cancer Awareness Month.
And one of the things that we can do is that if you need us to come up, we're more than willing to come up and present to your council the importance of making March Colorectal Cancer Awareness Month. It really shows tribal leadership supporting that effort, and we know that our communities, you know, most of the time, a lot of the time, look up to our tribal leadership, and so it's a great way to get the information out. We can help put it on in the newspaper. We can also help go on the radio and talk about it as well. It's a great way to get the information out to our communities.
Okay, so we're going to go on and talk about our new location. The Health Board is pleased to announce that the organization will be moving next month to a new location here in Rapid City, South Dakota. Our current facility is 2 buildings that separate our workforce. We are not ADA compliant, and our IT system is also very outdated. Our workforce has expanded tremendously, creating limited space and multiple staff members sharing one office. Let's see, what did I do here?
I would hit the button, the enter button.
Okay. So our new location. Oh, do I gotta go back again?
No, enter.
Sorry, guys.
Okay.
There you go.
There it goes.
Okay. So our new building's address is going to be 2611 Elderberry Boulevard, and that is off of East Highway 44. We will be ADA compliant. We'll have an improved IT infrastructure. We will also have a conference room and training rooms that will be available for rent to organizations who need meeting space. The training room will have a state-of-the-art smart board, audio, video conferencing access, and a large conference room that will have dual projection capabilities. And there will be a fee for that rental space. I'm not sure what that price is as of yet, but we will keep you updated on that. And as you can see, this slide shows the graphics of what the front and the back of the building will look like. We're very excited to be moving. Our move is scheduled for the 3rd week of February. And during that week, we may have limited access to our email and phone lines, but we will be returning all calls and messages in as timely fashion as possible. So that is my portion for today's presentation. I'm going to pass the bill to Ms. Lindsay.
Hello, y'all. Hope everyone's having a good day. Before we go over this next slide, we must inform you that the Great Plains Tribal Chairman's Health Board is prohibited from lobbying. With that being said, we will be simply providing you with an update about cancer events that are taking place throughout the Great Plains area with our partners at the American Cancer Society. Today, Jill Ireland from the South Dakota ACS office is unable to attend today's task force meeting because she is attending the ACS Day at the Capitol. South Dakota ACS priorities include indoor tanning, smoke-free South Dakota, access to care, palliative care, and improving quality of life. The ACS Cancer Action Network smoke-free law was passed in November 2010. This law protects all workers from the dangers of secondhand smoke, but they are now defending this law from those who wish to weaken it. Today is also Tobacco Prevention Day at the Capitol for our partners at ACS in Nebraska. Tamara Robinson is on her state capitol today along with their partners from American Heart Association and American Lung Association. The Tobacco Prevention Day at the Capitol will be from 8 a.m. to 12:30 p.m. If you are interested in learning more information about the Cancer Society or would like to join their efforts and fight cancer, please visit their website at https://www.cancer.org.
Or email us and we can send it to you.
Just push enter. Okay. South Dakota 2018 CRC Awards. The Colorectal Cancer Task Force of the South Dakota Comprehensive Cancer Control Program is soliciting nominations for the 2018 Colorectal Cancer Awards. If you have any more information or want any more information on that, please contact Brooke Lusk.
Today is the last day to get your nominations in. It's a very short process to nominate somebody, so it'd be great if you guys are interested in nominating somebody. I think the more the merrier. Again, today is the last day.
Okay. Upcoming webinars. We have a couple that we wanted to share. Goals of Care When Cancer is Chronic will be presented by medical Dr. James Clary. That will be February 5th. And February 8th is the Gastrointestinal Cancers Symposium in San Francisco, California, presented by Dr. Dustin Deming.
So there's going to be a lot of different events going on. The fightcolorectalcancer.org is a great website to go to. They're doing some events in Los Angeles as well. So if you get a chance, go to fightcolorectalcancer.org and see what's going on coming up in March and February.
March 28th is the presenter is going to be Leslie Welch. He will be sharing important information and tips on how to talk to your kids about cancer diagnosis. Strong Arm Selfie. Leading up to March, show your support for the fight against colorectal cancer by snapping a strong arm selfie. It's an easy, fun way to raise awareness for Colorectal Cancer Awareness Month. It is also a fun way to get your coworkers, teams, neighbors, friends, and family involved. Over the years, there have been thousands of posts, and each post retweet or share of hashtag Strong Arm sends $1 to fight colorectal cancer. Okay, what is this one?
So this is it's a new, it's called Hope Lodge in Nebraska. It's in Omaha. It is opening up. They're doing an open house on February 3rd. It is a great resource. They provide temporary housing free of charge for persons that may be going to Omaha, Nebraska for chemo, radiation, or whatever cancer treatment they may be going to. It's a 32-bed private with private rooms and baths, TV, sitting rooms, laundry facilities. It sounds amazing. I think it's, another great resource that we can use. If you happen to be in that area, please go down on February 3rd and check it out. Spread the word for those in Nebraska. I think it can be a great resource for our tribal members that are going through cancer treatment. I don't know if there's anything else you want to add to it.
No, just for admission information, contact the Hope Lodge location. Funding opportunities. The South Dakota Department of Health Cancer Programs are soliciting grant applications that support the 2015 to 2020 South Dakota Cancer Plan. The deadline is Thursday, March 15th, 2018 at 5 p.m. Central Time. Applicants must request up to $20,000. It is anticipated that 3 to 4 applications will be funded, and applications are due via electronic submission to Lexi Pugsley. Her information is on the slideshow. Another funding opportunity.
I didn't go. You might want to click it again.
Yep.
So that's the one that's showing.
It's the same.
Oh, is it? I'm
It's a
sorry.
different one.
Oh,
Yeah.
okay. Sorry.
The South Dakota Department of Health Diabetes Prevention and Control Program is inviting applications for the establishment of new diabetes self-management education support programs. The applications must be willing to enter into a contract with South Dakota Department of Health if awarded. The deadline is February 6, 2018 at 5 p.m. Central Time. And they're also due electronic submission to Melissa Cowell. Her information is in the slideshow as well. So next we're going to be passing it over to Eugene Gallego, who will be finishing us out today. Thank you.
Thank you. Thank you, Lindsay. Eugene, hold on just a moment and let me unmute you. 1 second, please. Where are you, Eugene? I just seen you. Hold on just a moment, please. There you are. Come on. Come on. Eugene. All right, I'm going to unmute all for a second and see how it goes. Having problems unmuting Eugene. Eugene, can you hear me now?
Yep, can you hear me?
Yes, I can.
Awesome. Thank you, Lindsay. Thank you, Gina, and thank you, Tinka.
Mhm.
So with the Native Public Health Innovation Award,
Right.
was created by the National Indian Health Board to recognize excellence, achievement, and innovations that are above and beyond the call of service. This award will be presented at the 9th Annual Tribal Health Summit in Prior Lake, Minnesota. All nominations should be submitted 11:59 on the dot on Tuesday, February 20th, 2018.
Hold on, Eugene. We're getting background noise. I'm going to try it again. Just a minute, please. Eugene, can you hear me now? I think it sent you an audio pin. For some reason, I can't unmute you. You must be talking through your computer. All right, we'll try. All right. If everybody can just,
Can you hear me?
yeah, I think we're just going to have to make sure everybody mutes themselves or tries to keep their background noise to a very low minimum. Thank you.
Okay, so I think there was a question on the chat box.
Oh, what's February 20th?
Can you hear me?
Yep.
Okay, so February 20th is the deadline. All nominations should be submitted by 11:59 p.m. on the dot. Tuesday, February 20th, 2008.
And that's for the Native Public Health Innovation Award, right?
Right, that's for the Native Public Health Innovation Award, which was created by the NIHB and recognizes excellence, achievements, innovations that are above and beyond the call of services. And I'm not sure if they're, last year they did it by regional, they might do it by that again, state, individual, things like that, and on a national level. So if you have any questions or you want any more information, please click on the link that shows the NIHB.org.
Or just go to nihb.org. This would be a great way to highlight somebody or organization or a person that goes above and beyond the call of service in your facility or your organization. This will be at Prior Lake, Minnesota, so be pretty awesome.
Okay, so next slide. Okay, so training opportunities. Scholarship opportunities are available through our Health Professions Opportunity Grant, HPOG. Students would need to contact Pathway to Healthcare Professions staff, or for further information, fees for the class need to be paid upfront due to costs associated with the course. For more information on billing and coding training, please contact Beth Lee, who is the Business Planning and Development Manager and American Academy of Professions Coder Education Provider.
Sure, and if you don't have her contact information, I don't know if it's on there, but you can always contact me or any of the staff here, and they can get you her email address and phone number or extension. She works here at the health board. So, yeah.
Thank you, Tinka. Next slide. The CRC Media, the Great Plains Colorectal Cancer Screening Initiative, would like to once again promote our media messaging. Through the great work of CAT Communications based out of Bismarck, North Dakota, we were able to create 2 colorectal cancer screening videos. The first video titled A Little Girl and Her Grandma, and this is the first video. I'm not sure, do we have enough time to play the video?
We sure do. So I'll go ahead and see if it runs off of this PowerPoint. If not, I have it pulled up.
Awesome, thank you.
What's this? Oh, okay, we'll try it this way. Can you see it, everybody? Can they?
I love my grandma. I love to go to her house. We always had fun. Then she went to the doctor. My mommy said everything would be okay. But she went to the doctor too late. Soon after, she got sick. And then one day, she was gone.
Give your loved ones the gift of being there. Get screened for colorectal cancer.
For more information on colorectal cancer and screening, Great Plains Colorectal Cancer Screening Initiative, 1-800-745-3466.
All right, so that's the first one. I'm going to go ahead and I'm going to go ahead and mute everybody again for the next one. And then after that, we will open it up and for questions, concerns, any other updates, any other organizations would like to have. But we have one more video we'd like to show you. So I'm going to mute y'all and I'll show the other video. Thank you. Come on. Oh, yeah. Okay.
This life is a gift. A precious circle.
And it's our responsibility, each one of us, to protect that circle and keep it strong.
Part of that means protecting our bodies from cancer.
Colorectal cancer is the second most common cancer among American Indians.
Those diagnosed with colorectal cancer
Who discover it early
have a 90% survival rate.
most of the time. There are no symptoms until it's too late.
Don't wait. Protect yourself from cancer.
Protect the circle. If you're over 50 or older, or have a family history of colon cancer, talk to your doctor about a colorectal screening. For more information on colorectal cancer and screening, contact the Great Plains Colorectal Cancer Screening Initiative, 1-800-745-3466.
Great. All right, so that was that one. I'm going to go ahead and unmute. Just to let you know that those videos are available for anybody that would like to use them. I'm sorry, huh? You can also put them on your website. We'd be more than happy to share them with you. We put them on Facebook. I am happy to say that one of them, the dancer circle, I think it was. Let me see, hold on. The dancer circle had, no, grandmother. The grandmother one had over 10,000 views. So I think we know we're making an impact. The dancer circle had over 7,000.2 views. So we're very excited. We also have 2 survivor stories that's been on Facebook as well. We know our demographics of the people that we're trying to reach. The 50 to 75 that we're trying to reach, that's the screening ages that we're looking at. They're the ones that use Facebook the most. So we have seen a big uptick in people watching these videos. So I think they're reaching out, and they are being showed on Facebook in the Northern Plains area. We've worked again with Cat Communications. They were amazing at being able to enter in the zip codes or the counties. I don't know exactly. I'm not that Facebook techie, but they were able to enter in, so they're shown in the Northern Plains. I hope you, if you are a Facebooker, that you see them. I see them all the time on my Facebook. I'm a Facebooker. I admit it. So if not, you might try and search in your Facebook search box and bring them up, and we'd love to have you share them with others. We will be running some more Facebook ads in March, so be on the lookout for those. Again, we have these in disc form. We have these, so you can download these videos and share them on your website. They have been playing on Good Health TV. So just reach out to us if it's something that you're interested in. Is there any questions? They're also on our website. And again, just to know, if you know somebody that wants to join our listserv and get information about coming out, if you can see me, I'm circling on the join our listserv. Please do that. There's a lot of these printables you could look at if you'd like to go. I'm going to click on it. And it's not working. It will be working. Oh, there's all these fact sheets that you can print. It's loading. It's a little slow. You can also call us and we can print them out for you for March. If there's certain, excuse me, if there's certain fact sheets, brochures, anything that you want, we can print them for you. We know printing can be expensive. Just email us and call us, let us know how many you would like, and we can mail them to you. This is a cute one, toilet chat. They got little poops. Aren't they cute? Take control of your health. It gets people to look at them. They're interesting. They're cute. They're funny. And sometimes that's a good way to get people to look at stuff. So we have fact sheets again. So I'm just kind of scrolling down. These are all available on download, or again, like I said, because they are color, we can print them out and mail them to you, or you're more than welcome to print them out yourself. If you're having problems with it, please let us know and we can help you. If there's other stuff that you don't see here, we will, like they said, I think Gina said, we will be sending out posters, and we'll be sending out just a box of posters, brochures, I think some bracelets possibly, to set out in your waiting rooms, in your, if you're a healthcare facility, in the rooms that the patients go in your hallways, you can hang up the pictures. You know, it'd be great if you guys at your organization would participate in March Colorectal Cancer Awareness Month, however would be best for you, but we have lots of stuff to give you if you want. If there's other stuff that we don't have that you're interested in, let us know. If you have some ideas, we're happy to work with you. We just really want to get the awareness out there for March, because this is our one time of the year that we can really push it and tell people and talk to them about getting screened and talk to them about the importance of being screened. So let us know. We're more than willing to help you with whatever you may need. Any other questions? Is there more slides? Oh, I'm sorry. I'm like jumping ahead of everybody. Okay, hold on. Is that you? Who is this? Eugene. Is this you, Eugene? Hello, Eugene?
Hello, can you hear me?
Yep. I thought we were done,
Okay,
and I was just
thank
trying to
you.
add time.
All right, this public service announcement was also developed by CAT Communications, also mentioned previously in the previous slides with the PSAs.
Want me to play it?
Life is a gift, and our strength as Native people comes from the unbroken sacred circle. Each of us must take the steps to wellness. March is Colorectal Cancer Awareness Month. If you are 50 or older or have a family history of colon cancer, schedule a screening at your local health facility today. For more information, please contact the Great Plains Colorectal Cancer Screening Initiative at 1-800-745-3466 or visit cdc.gov/cancer/colon.
Oops, what happened? Oh, I must have paused it. But that was it. It's a very short 30-second video, so we'll be playing that on the radio stations in the Northern Plains, so be on the lookout for to hear that on your local radio station.
Next slide. And also for the Show Your Blue month of March, we'd like to share a photo from last year's Show Your Blue Great Plains photo contest. This photo was from our program evaluator, Asset. Remember to use the hashtag and show your blue. Next slide. If you have any questions for today's presentation, please feel free to call or email any one of our patient navigators as well as Tinka. Our contact information is included on this slide. And I'll turn it over to Tinka.
Okay. I think that's all we have. I don't know if we have any other organizations. Looks like we have about 20-some people on the call. Does anybody else have anything that they would like to share about maybe what they're doing in their communities in March, or does anybody have any updates? The mics are on, so if you have any updates or anything, please feel free to, or any questions, let us know now. Okay. Well, with that, we're going to go ahead and end then. We thank you for your time. Please feel free to reach out to us again if you think of something that you, I'm sorry. Hello? Oh, sounds like background noise. So anyways, thank you for your time, and have a great rest of the week and great rest of your day. Thank you. Bye.